Good morning, students. So, today's class we are going to study about heart rate variability. So, the variation in heart rate, so it can be measured by many mathematical methods. So, we are going to analyze the heart rate variability today. So, before going to that, let us see what is the how the heart rate is increased or decreased. So the heart rate is controlled by the sympathetic and parasympathetic nervous system, so mainly by the peripheral nervous system. So if there is any fluctuations in the heart rate, it usually reflected by the peripheral nervous control system only. So mainly due to the parasympathetic and sympathetic action. So if you see the analyze the heart rate variability, so it changes over the time here. So this is a simplified model of a cardiovascular control system. So in this, when the heart rate is increases, when the heart rate get increases, when there is a stimulations in the sympathetic nervous system, the heart rate will increase, and the heart rate is bring back to normal by means of parasympathetic nervous system. So here, when the heart rate is increased, so what will happen? The cardiac output and the blood pressure is also increased due to the renin-angiotensin system. So in that case, then this parasympathetic nervous system is responsible for bringing the heart rate to a normal state. So it is like a feedback loops. The sympathetic nervous system and sympathetic nervous system functions controls the heart rate. So hence, it is given in a feedback loop like this. So, what are the factors which influence the heart rate variability? So, one is in extrinsic rhythms, another one is intrinsic factors. So, in extrinsic rhythms, those are the activity, the sleep wake cycle, and food habits, that is, eating meals, mental stress, or physical stress. So, these are the factors which influence the heart rate variability. And what are the factors which introduces intrinsic periodic rhythms are respiratory sinus arrhythmia. So if the person is having some respiratory problems, so they have some sinus problems, so arrhythmia will occur here there. So that is called respiratory sinus arrhythmia. Then baroreceptor reflex regulation and thermoregulation, endocrine secretions, circadian rhythms, sleep stages during the night, and other unknown rhythms. So these are some of the intrinsic periodic rhythms. It influences the heart rate variability and it changes the heart rate variability either to increase or decrease. Now, the some of the quantifying parameters which is used to analyze the heart rate variability are one is the physiologist paradigms. According to that, they will collect the heart rate over a short period of time. Say example for 5 to 20 minutes durations in a controlled laboratory condition. Second approach is the clinicians and epidemiologist paradigms in which using the ambulatory Holter recordings, they collect the heart rate over a 24 hours durations, usually on the outpatients. So in the approach one, how much variability is there? So that can be analyzed by means of time domain and geometric analysis. So in the approach two, it is what are the physiological process do they represent? How much power does the underlying each underlying rhythm have? To infer these informations, frequency domain analysis is used. Now let us discuss about the time domain HRV. So it has been calculated from normal to normal interbeat intervals, that is called N to N intervals. We can also call it as R to R intervals. So certain parameters are estimated from this R to R intervals. Those are SDNN, that is standard deviation of N to N intervals in milliseconds. So that we call it as total HRV. Then SDANN is standard deviation of 5 minutes mean value of N to N, for which is measured for each 5 minutes interval, which is called as circadian HRV, and both SDNN and SDANN reflects the longer term HRV. Then we have other parameters called SDNN-IDX, which is nothing but average of standard deviation of N to N interval for measured for each 5-minute interval in milliseconds. This is due to the combined effect of sympathetic and parasympathetic HRV, and this reflects the intermediate term HRV. Then average N to N interval, which is measured in milliseconds. So it can be it is equivalent to heart rate of normal to normal beat. So heart rate can be calculated by 60,000 divided by AVNN. And then other parameters that is calculated from the difference between the successive end-to-end intervals. Those are RMSSV, root mean square of successive difference of end-to-end interval, which is measured in milliseconds. PNN50 is percent of successive end-to-end intervals whose difference is greater than 50 milliseconds. So this is referred as short-term HRV. It is reflects the parasympathetic influence of the heart rates. That means the parasympathetic influence in the sense it will bring back the heart rate to the normal state. Then the next one is frequency domain HRV. So in that we could able to analyze using the autoregressive techniques or fast Fourier transform. So if you see the frequency, various frequencies associated with the distinct intrinsic and periodic rhythms are observed here. Now we have an example. So if you see this particular waveform, it is looks like a sinusoidal waveform. So in that one rhythm, which is equivalent to 5 seconds, you can able to see in the x-axis it is given the time period. In the y-axis, amplitude is mentioned. And each subdivision of in the given in the time period is 5 seconds. So that's why one rhythm, one cycle is 5 seconds. So totally how many cycles are there if you count each cycle? So it is 12 times per minute. So now in this, when you take the FFT frequency domain of it, so it gives you the, in the 5-second cycle, so it is 1 by 5 equal to 0.2 hertz. That is the frequency which is obtained for this particular rhythm. Now, if you see there are three different signals are there, if which is having three different amplitudes and three different frequencies. So those and if you see if you add all these things, this is the addition of this waveform. Then finally, when you take the frequency spectrum of it, we can get three different frequencies. So when you see high frequency, it is 0.25 hertz. How we are getting is if you have the high frequency signal, so you can count it how many number of cycles are there. It is 15 cycles. So 1 by 15 it's 0.25 hertz. And in the case of low frequency, if you count it is 6 cycles per minute. Again 1 by 6 it is around 0.1 hertz. And very low frequency is 1 cycle per minute. So which is 0.016 hertz. So in this way we can able to differentiate high frequency, low frequency and very low frequency rhythms. Now in this heart rate variability, the first one is high frequency band. So its respiratory frequencies varies between 9 to 24 cycles per minute and the parasympathetic nervous system it influences the heart rate. And in the case of low frequency band, every 8 to 10 second frequency we call it as low frequency band. The baroreceptors, sympathetic nervous system, parasympathetic nervous system influences on the heart rate. Then we have very low frequency bands. So it is at every 20 seconds or every 5-minute frequency we use to measure this very low frequency band. It reflects the vasomotor changes, thermoregulatory and possible peripheral nervous system, that is parasympathetic nervous system. It influences the heart rate. The next one is ultra low frequency band, which we call it as ULF. So it is at every 5 minutes to once in 24 hours we used to get this ultra low frequency power band. So this reflects the circadian rhythm, neuroendocrine and activity and other unknown rhythms. So if you see the for 24-hour average of 2-minute power spectral density they have taken for a healthy adult, you can able to observe the low frequency peak and the high frequency peak. So this is a comparison of normal versus the random HRV. So you can able to get the power plots here. And what are the clinical correlates with the decreased HRV is due to? The decreased HRV is due to the inducible VT, that is ventricular tachycardia and ventricular fibrillation. So due to these two things, the heart rate decreases. Then due to the risk of sudden cardiac death, increased myocardial infection, post myocardial infections, then congestive heart failure, poor survival in the congestive heart failure, and chronic obstructive pulmonary disease called COPD. So these are some of the factors which is responsible for decreasing the heart rate variability. Then other things are diabetic neuropathy, alcoholic neuropathy, post cardiac transplant, depression, susceptibility to cysts, poor survival in premature babies, increased mortality in population studies. So what are the pitfalls in understanding the HRV is, so if the person is doing some exercise, so that time he'll have increased heart rate variability. So in that case, we cannot take it as the condition is due to some abnormal conditions. We are getting increased heart rate variability because During the exercise, the heart rate is increases. That is quite nature. And this HRV can be exaggerated by increased randomness, which is not truly a normal sinus rhythm. So, despite the normal appearance of the ECG. Then the clinical implications are normal HRV is a good negative risk stratifier. Patients with the preserved HRV are low risk in the absence of other significant factors. And sensitivity and specificity of decreased HRV is the SGNN is less than 70 milliseconds for immediate post myocardial infarctions. How can the HRV can be increased? So lifestyle modifications, we have to stop smoking, weight loss, exercise, stress management, lipid lowering, glycemic control can increase the heart rate. So finally, the analysis of the HRV is a non-invasive method for identifying any abnormalities in the cardiac autonomic modulation. And the decreased HRV is not due to the sufficient to risk the satisfying patients. So the HRV in combination for other risk satisfied improves the risk stratification. And normal HRV identifies the patients at low risk for events. And there are certain cutoff points for HRV, which is population specific, and it has not been fully elucidated. And it now appears that the decreased HRV and increased randomness of HRV independently associated with higher risk. Thank you.